Okay, go ahead.
Okay, so we are group 3. I am Sarah Ames, and Daniel Weston-Scow and I are going to be discussing the accreditations of healthcare organizations. So to begin, what is accreditation? Accreditation, according to the ACHC, is a process of review that healthcare organizations participate in to demonstrate their ability to meet predetermined criteria and standards of accreditation established by a professional accrediting agency. So when an agency surveys an organization, they evaluate the overall quality of care. It increases their seal of approval for an organization after requirements have been met on site, and that's performed by an expert. So some things that they survey include organizational structure. They also evaluate the governing board of the organization and see how it functions. Policies and procedures, compliance with state and federal laws, patient rights and responsibilities, human resource management, quality outcomes, performance improvement, infection control, safety, and how everything operates. Okay, let's go to the next slide. So the question was, is accreditation voluntary or is it required? And it's completely voluntary. Healthcare organizations are not required standards. Accreditation is a voluntary process that the organizations put themselves through to document the quality of, oh, there's a spelling error, care that they offer. One thing that I found really interesting is that organizations that have not chosen to become accredited, they do still have some standards they must meet according to the federal government. And this is in reference to the providers and the billing and the relationship with the CMS. The benefits of being accredited are they are able to identify strengths and weaknesses in their organization, improve effectiveness and efficiency of performance, and they can establish a benchmark as an organization and see how far they've come down the road, and have something to compare their accomplishment and everything to. They set a higher standard of care for patients and employees. I know that when you know something is accredited, you're more inclined to choose that specific facility. And as an organization, it'll boost their overall performance. Accreditation is the highest standard. It is a higher standard than what the federal and state governments require. Slide 4. Did you want to do this one, Daniel?
Yeah.
Okay.
Yeah, so from keeping in mind that an accreditation is a voluntary standpoint, right, what would motivate a healthcare organization or a physician to either become accredited by an association or for a physician to get a board certification? So from a healthcare perspective, like Sarah touched on, reputability would be one of the key factors. Knowing that a certain healthcare facility has been accredited by a certain organization carries a lot of weight with it. So not only from a client and a customer perspective, but also from the ability of a healthcare organization to grow its business with, other providers or other networks. Being accredited can tie you in from a monetary standpoint as well. And then another key thing would be that it falls in line with some kind of initiative or a core value or a goal that would coincide with some healthcare organization's commitment to, its community and its overall objectives for its employees. And from a physician standpoint, it is voluntary that they can become board certified, but there's big consequences if they don't become board certified. In my line of work, we do healthcare staffing, and we work specifically with physicians all across the country. And there's very many, most of the jobs that are available to these providers now require board certification, and that's because of the bylaws written within the hospital. More and more facilities are moving towards only hiring board certified physicians as an aspect of quality care. There's the physicians that are not board certified that we work with. There's very limited jobs available to them, and most of the time they're in extreme rural settings where the bylaws can be flexed a little bit to meet the demands of just physician needs. We kind of I looked at it as kind of internally here at our company, we have a book club, and you can go to book club or you don't have to go to book club. It's completely voluntary. But if you don't go to book club, it's extremely frowned upon. So from a healthcare organization and physician standpoint, for them to be accredited or board certified is more and more becoming a requirement to demonstrate their commitment to improvement and their commitment to a process and to meet the standards of healthcare coming forward. And this was a cute little thing. Sarah, you want to touch on that?
Yeah, I stumbled upon this a couple days ago. So I said, thank goodness for board certified physicians. And as you can see, there's that patient with his eyeballs bulging out of his head. And the doctors are just saying to each other, with these get-ups, any lunatic off the street could sneak in here and pretend to be a surgeon. So I just think that was kind of light and funny, but there's a little bit of truth to that there can be fear on the patient's perspective that, my doctors aren't board certified. Well, what really have they been trained in? Obviously, they have their license, and but I thought that was a little funny. And I think that a doctor seems much more reputable with that board certification. And I actually think it's great that more facilities are requiring that. I think it just increases that standard and gives you a little comfort as a patient.
So there's multiple accrediting organizations, and there's a lot more that are on this list. The reason why the ones that you see here are important is because they have been approved by CMS. And CMS, as you know, is the governing body for Medicare and Medicaid services, which is also tied to the financial aspect, a big portion of the financial aspect of the healthcare industry. So up until recently, there was not this many accredited organizations. There were only a few. And so the main ones that we'll talk about are the ones at the bottom. There's the most significant one Sarah will touch on.
Okay, so the Joint Commission is the most prestigious accreditation. It is the gold standard. It is a much more expensive survey. And obviously, I know the next group is going to be presenting on this. We won't go into much detail, but they have more of a clinical focus. And okay, so let's go to the next slide. We don't need to go into that very much. The International Organization for Standards. Okay, there we go. So the ISO. So I just went back through the history of the ISO. It was founded in 1947. 27 countries came together and met in London, and they wanted to coordinate and unify industrial standards as an internal body. They wanted those standards to be the same in all their countries. So interesting. It was the international acronym for the International Standards Organization is ISO, but it's also based on the Greek word isos, which means equal, as in isometric, isosceles, and isotope. Back in October of 2008, the CMS granted authority to the DNVH, also known as the National Integrated Accreditation for Healthcare Organizations, making it the third CMS-approved accrediting program in the United States. So about the ISO, it is not an accreditation, which is something which was interesting to learn. It's a certification. So they don't officially accredit facilities. They set this as a standard, but it's different from, say, the Joint Commission in that their focus is more on quality management. It's not clinical. They accredit all kinds of businesses, healthcare facilities, but also manufacturing, food safety, technology, and agriculture. A great thing about it is it's internationally recognized that quality of care standard is the same internationally. As I mentioned, they focus on business practices. It's less expensive than the Joint Commission survey and not as extensive. They have over 19,500 standards, and they're now in 165 countries and have over 3,000 technical bodies. So the auditors for the ISO are authorized to award a certification of compliance. And the highest one that I could find is the ISO 9001 from 2008. That standard is current from 2014. It certifies companies and other organizations. It must be reviewed annually and renewed every 3 years. The implementation of standards, the ISO 9001 implementations should be set on a system of dynamic processes rather than a set of static standards. It requires procedures for the following activities to be documented and evidence maintained that they are being followed. These include control of documents and records. So they're gathering customer requirements and product testing, control of non-conforming product to prevent defective products from being sent to customers. And again, this is for all types of businesses and organizations, not just healthcare. Continual improvement for corrective and preventative actions. This is necessary to prevent mistakes from being made again. And then they do conduct internal audits. It shows commitment, their standard to be high. They want the 9001 quality of standard. Maintaining the ISO standard, it helps a company focus on efficiency and effectiveness within their organization.
So you can tell, based off of all that content that, Sarah described, that the ISO accreditation or certification is much more broad and encompassing than some of the other accreditations, taking into consideration food and safety and just various aspects of the whole healthcare organization itself, encompassing multiple facets. Even to the extent of their management principles. And so here are the 7 they call them QPMs, quality management principles, that are part of the accreditation certification process. So to have a great customer focus, to the leadership aspect of it is important. That there is the engagement of people. It's a process approach. There's continual improvement, and that it's evidence-based decision-making and relationship management. So it helps identify kind of some specific core values or core focuses for the healthcare organization in more of a broad aspect. One of the questions was to find out why Madison Memorial Hospital, which is a hospital in Idaho, chose to do the ISO accreditation versus many of the other accreditations. And this was, although we didn't get a chance to speak with management, we were able to find in one of their blogs online that the reason why they decided to choose, the reason they chose ISO as their accreditation. So some people have asked why we opt out to be accredited by DNV versus another accreditation body like the Joint Commission. So DNV is the governing body of the ISO 9001. They created that product. There are 4 accreditation bodies that have been approved by Medicare to survey hospitals. So why DNV? It comes down to philosophy. In May 2001, we became the 13th hospital in the United States to become certified to the ISO 9000 standards, and DNV has built their surveying process off the ISO standard. ISO is not an accreditation, it is a certification. ISO is all about continual improvement, and that's what we want to our accreditation. We want our accreditation body helping us to do. So a couple of interesting points. They adopted ISO even before it was an approved CMS accreditation organization, several years before that. So it kind of speaks to the desire of their employees to kind of develop that culture, right? And they speak specifically that it comes down to, where does it say it in there? It comes down to philosophy. And if you look through their core values, there's a lot of integration with continual commitment for improvement. So those are some of the things that they saw with the ISO 9000 integration and why they wanted to incorporate it into their system. Making a little bit of a comparison, you've got your standard practice or your standard medical school, right, from an MD standpoint. That's your traditional medical school. And then you had others that wanted to develop kind of a whole body approach or a different way to treat medicine, and that's where you got your DOs. And so kind of there's a little bit of a correlation there where ISO is just a little bit different from your standard, accreditation that's been around for so long, and looking at a more all-encompassing approach of certification, continual improvement, and how it correlates with the healthcare organization's values. So those are the references we used in creating the presentation.
Awesome, great work, guys. Covered that topic really well. Really covered, the questions. That's great. So when you reached out to Madison Memorial, they just didn't get back in contact with you, or did they direct you to that blog? Or
no, when I didn't reach out to them. I just thought, I wonder if there's some information online rather than calling them. So since that was so descriptive, I figured that's going to answer the question. Yeah,
that's perfect. They a while back they kind of got a little upset with us for
they did
having so many students contact them.
I thought that might be the case too. Yeah,
and then on one places in the course site, that last question about Madison Memorial Hospital was not listed in the requirements for group 3, actually. It was somewhere else on the site just a few days ago that I saw that question. I can send it to you. So maybe you were, I don't know, maybe you took that question off a while back.
Yeah. let me know about that, where that is, because we're trying to get it cleaned up and do all that. But yeah, thanks. If you need anything like that, let me know.
Okay. Okay.
But that's awesome. So really quick though, I just wanted to ask each of you. We'll start with you, Sarah. What was the most interesting thing that you learned?
To be honest, I'd never heard of ISO. So learning about ISO was really interesting to me. That it's international. It's a standard of operating an organization, a standard of quality in many different types of businesses. And although it's not hospital medical specific, the ISO 9001, it's a great certificate to achieve. And reading about the Madison Memorial Hospital, I think that, you know, it's a great facility, and they chose to go that route rather than Joint Commission, because they do have a very high standard that is met. So that was one interesting thing that I learned.
Great, thank you. All right, Danny, same question.
Yeah, mine probably correlates a little bit with that. Our company is currently in the process of taking initial steps to become accredited by the NCQA. And, you know, after reviewing this information, you know, kind of makes me think to take a second look at that and see, you know, which accreditation board or organization we really want to complete that process with. You know, like Sarah, I'd never heard of ISO, never heard of the D&V. And then looking into it, it was surprising to see how many good healthcare organizations have adapted and implemented that idea and that process, including here locally in Utah, Jordan Valley Medical Center and the University of Utah, where the chief medical officer actually reinstilled those values on their website, you know, as what they're focusing on, the management, quality management principles. So, you know, for me, it was just kind of learning about that new accreditation and the fact that we're getting more options with CMS, which I think is good, because so long it was just the Joint Commission. So that was an interesting part for me.
Awesome. Thank you both for that. I'm going to stop recording, but hold on for just a second.